Welcome. Today we're diving into a serious lung condition called diffuse alveolar hemorrhage syndrome, or DACH. We'll explore what it is, what causes it, how it affects the lungs, and what can be done about it. This video is for educational purposes only and doesn't substitute professional medical advice. DACH is characterized by widespread bleeding into the tiny air sacs of the lungs, called alveoli. The causes are diverse. It can be triggered by autoimmune diseases like lupus, granulomatosis with polyangiitis, microscopic polyangiitis, and Goodpasture syndrome, where the body mistakenly attacks its own lung tissue. Infections, especially severe ones, can also damage the alveolar walls and lead to DH. Exposure to certain toxins or medications, bone marrow transplant, and rarely, underlying blood clotting disorders are also considered to be potential causes. Sometimes the exact cause remains unknown, termed idiopathic DIA. Let's understand what is happening in the lungs. Normally, the alveoli are where oxygen exchange happens, allowing oxygen to enter the bloodstream and carbon dioxide to exit. In DAT, the walls of the capillaries surrounding the alveoli are damaged. This damage causes blood to leak into the alveolar spaces. This filling of the alveoli with blood impairs oxygen exchange, leading to shortness of breath and a decrease in blood oxygen levels. The inflammation associated with the underlying cause also contributes to the lung injury and exacerbates the bleeding. DIH is a relatively rare condition. It can affect people of all ages, including children. The frequency depends largely on the prevalence of the underlying conditions that cause it, such as autoimmune diseases. Certain populations, like those with pre-existing autoimmune disorders, might be at a higher risk. It is important to note that accurate epidemiological data is challenging to obtain, because DIH is often a complication of another underlying condition. The symptoms of DH can vary in severity, but some common signs include shortness of breath, which can range from mild to severe, a cough, which may produce blood, or hemoptysis, a fever is also common, and chest pain. Over time, if the bleeding is chronic, anemia can develop, leading to fatigue and weakness. The onset can be sudden or gradual, depending on the cause and the extent of the bleeding. Diagnosing DIH requires a comprehensive approach. A doctor will start with a thorough medical history and physical examination, followed by imaging studies such as a chest X-ray or CT scan, which can reveal signs of bleeding in the lungs. Bronchoscopy, a procedure where a thin, flexible tube with a camera is inserted into the airways, is often performed to visualize the airways and collect fluid samples for analysis. A bronchoalveolar lavage bowel is when fluid is squirted through the bronchoscope and then collected for testing. This fluid can be examined for the presence of blood and other indicators of DH. Blood tests are also essential to assess for anemia, markers of inflammation, and to identify any underlying autoimmune conditions. While DIH doesn't have strict classifications, it's often categorized based on its underlying cause. For instance, DIH associated with autoimmune diseases is categorized under that umbrella. DIH due to infections would be classified under infectious causes. Identifying the underlying etiology is essential for guiding treatment and management strategies. Treatment for DH focuses on stopping the bleeding, supporting breathing, and addressing the underlying cause. Corticosteroids are often used to reduce inflammation in the lungs, especially in cases related to autoimmune diseases. Immunosuppressant medications may also be prescribed to suppress the immune system and prevent further lung damage. In severe cases, mechanical ventilation may be necessary to support breathing. Plasma exchange, a procedure to remove harmful antibodies from the blood, may be used in certain autoimmune-related cases. Blood transfusions may be required to treat anemia. Treating the underlying cause like an infection is crucial to resolve the syndrome. Supportive care, including oxygen therapy and monitoring of vital signs, is essential. Preventing DH primarily involves managing and controlling the underlying conditions that can lead to it. For individuals with autoimmune diseases, adherence to prescribed medications and regular monitoring are crucial. Avoiding exposure to known lung irritants and toxins can also help. Prompt treatment of respiratory infections can minimize the risk of DIH. However, in cases of idiopathic DH, prevention can be more challenging. The prognosis for DH varies depending on the underlying cause, the severity of the bleeding, and the overall health of the individual. Early diagnosis and prompt treatment are crucial for improving outcomes. In some cases, DH can be a life-threatening condition, while in others, it can be managed effectively with treatment. Recent research is focusing on developing more targeted therapies for autoimmune-related DH and identifying biomarkers for early detection. Further research is needed to improve our understanding of DAC and develop more effective treatment strategies. Always consult with qualified healthcare professional for diagnosis and treatment.